Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about when should you be using medications for peripheral neuropathy and for peripheral neuropathy symptoms. One part of managing the symptoms of peripheral neuropathy is deciding when medication is a good idea. The truth is, in most cases, I recommend that we not use medication, that we work on getting some type of improvement as opposed to just masking or controlling the symptoms that way. But there are some individuals where medication is a good idea and a good option. So when we're talking about medications, there are really several different groups of medications that are used for peripheral neuropathy. Number one would be basically straight pain medication, like the narcotic pain medications, including Percocets, Loratab, Norco, morphine, those types of things, which I've seen all of those at various levels be utilized to treat neuropathy pain. The problem with narcotic pain medications is they literally are treating just the pain. And in neuropathy type pain, they're really at best 50% effective. The studies show that they will not take your pain completely away. That if you get a 50% improvement, that is the best you could hope for. And in a lot of cases, it doesn't even do that. So the problem with that is a lot of times people will increase medications over time because it's just not working. So when would I use pain medications for peripheral neuropathy? I can't think of a reason why I ever would. So there's really not a good excuse, just because it's really not going to do what you want. It's not going to make it that much easier to sleep. It's not going to make any of that kind of stuff. And the side effects and the negatives of those medications significantly outweigh any benefit you might get. So that would be my recommendation. I usually don't use those at all, if at all possible. Number two is nerve modifying medications such as gabapentin, Lyrica or pregabalin, Cymbalta, or even some of the other medications like amitriptyline or nortriptyline, those type of things. All of those medications are designed to interfere or modify the way the nerves are functioning to help you reduce symptoms, especially night symptoms. I do use these medications at some points, the idea being to give someone a period of time while we try to get the handle on what's going on. So you say, okay, we're going to put you on these nerve modifying medications for a short period of time so you can sleep, so you can function normally or more normally, while we figure out exactly what's causing it and what kind of treatments are available to really improve your peripheral neuropathy. In a lot of cases, we're not even using those because we can say, okay, we can modify this quick enough that we shouldn't need to do that. The disadvantage of these nerve modifying medications is they interfere with some of the treatments that we utilize. For example, Calmare treatment that we use sometimes to help manage the symptoms of peripheral neuropathy. This will interfere and not allow it to function quite as well. Third type of medication are different types of topical medications. And I would include in this even the CBD oils that you can rub on the areas. So it could be everything from essential oils to arthritis type creams, gels, to biofreeze, to like we said, CBD oils. The idea is different combinations. And there are even some medications that you can actually mix through a compounding pharmacy, same type of thing that you rub into the area, and they will decrease the symptoms, decrease the pain in that area. These are another medication that you may want to consider short-term or for breakthrough type symptoms, but again, should probably not be something that you're hoping to use for the rest of your life every single day. So those are the three main medications that we run into. Now, in saying that, if you have diabetes, for example, there are medications that will modify your peripheral neuropathy just by controlling your diabetes. So that fourth group is medications that you will utilize, whether it's thyroid medications or diabetes medications or HIV type medications, different medications that will manage the disease, help you control the disease process so you're not continuing to damage the nerves. These medications should be utilized. So when it comes to medications, pain medications, most of the time I will not use. Nerve modifying medications we'll use typically for a short period of time or in a certain window to allow us to get control of your peripheral neuropathy. Topical medications can be utilized, but should be basically focused on those breakthrough or those symptoms that we can't always keep, or if you have a bad day, you can utilize. And then medications that are disease-modifying medications should be utilized based on how your doctor is prescribing them to control and manage the disease processes. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 43, when you should utilize medications